Abby, my name is Sonali, of course, and my presentation is on the significance of the RH factor. The second part of this presentation is going to be given by my partner Alejandro Sanchez. So I'm going to start by talking about what is the RH factor. RH factor is known as the rhesus factor, and it is a part of your DNA. Everyone has two parts to their blood type. You have your type, which is the A, the B, the AB, or the L. And along with that letter, you have the rhesus factor, which is the positive or negative. How do you get that positive or negative? Well, how do you determine it, to be honest? So if the protein D antigen is present on the surface of the red blood cell, the blood will be known as positive. And then if the protein D antigen is absent on the surface of the red blood cell, then the blood will be known as negative. So you guys can see in this picture where it says RH blood group system, there is the antigens present on the positive, those little square things with the stick, where the stick figures are, yeah, that's known as an antigen, and that makes it positive. So how does a person get the RH factor? The RH factor is inherited, meaning it is passed from a parent to child through genes. The fetus can inherit the RH factor from the father or the mother. How can the RH factor cause problems during pregnancy? During pregnancy, problems can occur if you're Rh negative and your fetus is Rh positive. When a woman is Rh negative and her fetus is Rh positive, it is called Rh incompatibility. So if the blood of an Rh positive fetus gets into the bloodstream of the Rh negative woman, her body will understand it is not her blood, and it will fight it by making anti-Rh antibodies. And these antibodies will cross the placenta and try to destroy the fetus's blood. So you guys might ask, how can the fetus's blood get into my bloodstream? So there can be a lot of ways. During pregnancy, a woman and her fetus usually do not share the blood, but sometimes a small amount of blood from the fetus can get mixed with a woman's blood. This can happen during labor and birth, but it can also occur during an amniocentesis, which is the sampling of the amniotic fluid, and that basically is a procedure where they use a hollow needle and it's inserted into the uterus, and it screens for any developmental abnormalities in the fetus. There can also be bleeding during the pregnancy, of course, which is what I talked about earlier. There can also be attempts before a labor where you manually turn the fetus from the breech presentation, and then also trauma to the abdomen during pregnancy. How can Rh problems affect the fetus during pregnancy? So, red blood cells carry oxygen to all parts of the body. Without enough red blood cells, the fetus will not get enough oxygen. In some cases, the fetus can die from anemia. The reason why they die from anemia is because the red blood cells are destroyed faster than the body can even replace them because there's a lack of oxygen. Can the Rh factor cause problems during my first pregnancy? So health problems usually do not occur during an Rh negative woman's first pregnancy with an Rh positive fetus. And that's because her body doesn't have a chance to develop a lot of antibodies. But if preventive treatment is not given during the first pregnancy, and later a woman gets pregnant with the Rh positive fetus, she can actually make more antibodies, and the more antibodies put the future fetus at risk for a hemolytic disease of a newborn. So how do you learn if you are Rh negative? So a simple blood test can be done to determine your blood type and the Rh status. Usually when you're pregnant, this sample is taken at your OBGYN's office. And it's usually known as the first prenatal visit. Another blood test is called an antibody screen, and that can also show if you're an Rh negative woman and has made antibodies to Rh positive blood. Can the Rh problem be prevented? Yes, The goal for this preventive treatment is to stop an Rh-negative woman from making an Rh antibody in the first place. And this is done by finding out if you're Rh-negative early in the pregnancy. There is medication for this to prevent the antibodies from forming, and that is called Rhogam. And my partner, Alejandra Sanchez, will be talking about it in her half of the presentation. So I hope you guys enjoyed my half, and I can't wait to hear Alejandra's half too. Thank you.
So this part of the project is Rhod immune globulin, also known as Rhogam. So how Sonali mentioned, mothers can be Rh positive or Rh negative, and the baby can have a different Rh factor than the mother. So when they do, that's when they receive Rhogam. Rhogam is a medication that prevents the mother's own antibody formation in response to Rh positive fetal blood cells, which could endanger future Rh positive infants. It also increases platelet count in patients with ITP. So who receives this medication? Does Rhogam get administered to the baby or to the mother? So Rhogam is administered only to the mom and never to the baby. It is given IM at 28 weeks gestation and within 72 hours after delivery in order to prevent the production of antibodies. So Rhogam can only be given IM, but Winro SCF, which is another immune globulin, can be given IM and IV. So why does the mother receive Rhogam? Rhogam is given to mothers who are Rh negative and have an infant or a baby who is Rh positive. If the mother still happens to have a miscarriage or abortion, the mother still needs to receive Rhogam if her baby is Rh positive. Okay, so let's say the mom has baby number 1 and this baby is Rh positive. So she will receive Rhogam with this baby to prevent any complications with baby number 2. So now she has another baby, baby number 2, and she is also Rh positive. So we would administer Rhogam. If the mother becomes pregnant with the second Rh positive baby, then her antibodies will cross the placenta and attack the baby's blood, causing a condition called hemolytic disease of the newborn. So this usually is not a problem because the mother's blood and the fetus's blood does not mix, except during delivery or certain procedures like an amniocentesis or a CVS or any type of trauma. The mother may be exposed to red blood cells from her Rh positive fetus during these procedures. The first pregnancy of the mother is not usually affected by Rh incompatibility. That's because it can take longer than 9 months for an Rh negative mom to make antibodies that fight Rh positive blood. These antibodies will sit in and wait for the next pregnancy, and once the Rh positive cells are recognized, the antibodies are programmed to attack. So, the procedure such as an amniocentesis or a CVS is performed. Rhogam should be administered to the woman if she is Rh negative to prevent alloimmunization. Documentation should be added to the medical record and provided to the woman for future reference. So complications that can occur is that the baby can develop hemolytic disease of the fetus and newborn. This occurs when a mother develops antibodies against her baby's own red blood cells and destroys them, which can lead to anemia, jaundice, and edema. Hydrops fetalis can occur, which is a serious fetal condition with abnormal accumulation of fluid in fetal compartments. The unborn baby might need intrauterine fetal blood transfusion and an early delivery. The newborn will most likely need a blood transfusion because of the severe anemia. It will most likely be on a ventilator to help the newborn breathe. So when giving Rhogam, we can see an allergic reaction. The mother should be observed for at least 20 minutes after administration, and you would see any wheezing, low blood pressure, like swelling of the tongue, or vomiting or hives. Some side effects include hypotension, headache, and the most common one is discomfort or swelling at injection site. So, hospitals have different policies regarding Rhogam administration. The following steps are from the policy and procedure guidelines from Alaska Native Medical Center. So first, if mother is Rh negative, cord is sent to the blood bank for type Rh and direct Coombs test. If infant is Rh positive, mother will need Rhogam. So in a workup, draw and send appropriate specimens. Blood bank will notify nursing personnel when Rhogam is available to be given. Rhogam must be given within 72 hours after birth of infants. Then the nurse must go to the blood bank to get Rhogam with a copy of the patient's sticker. Rhogam numbers will be inspected by nursing and laboratory personnel in the blood bank. Then the nurse will check the patient's identification with 2 identifiers and explain procedure and purpose of Rhogam before administration. Administer Rhogam IM, complete patient Rhogam identification card, and give to patient. So some agencies include a final R that represents that Rhogam and rubella immunization was given. This is my reference page, and thank you so much.